Hi, welcome to another episode of Silver Fox Scotland. There is a problem in the NHS with bed blocking, and it's predominantly elderly people who can't get home. And the reason they can't get home is that there's no care package available, there's no plan, there's no way you can just sometimes drop an elderly person straight out of hospital and go, there you go, pet, on your way, because they're still quite vulnerable. They need excess care, they'll need neighbourhood nursing. My mother, for years, was a district nurse. So used to go around and she'd be knocking on doors up and down the region, on the area, administering medication or doing tests and things on predominantly elderly or housebound people who couldn't get out. It's a valuable service. It's one that's much needed. They need a lot more district nurses. But this social care assistance just isn't there. And it means that there are 7,000 people left in what's described as being in limbo, basically occupying a hospital bed when they shouldn't really be there. They could be at home, but because nobody's bothered or is able, a mixture of the two, I think, to sort out the social care, they're not getting it, are they? And this, of course, is down to the fact that nobody wants to be able to fix the NHS. You do have a health minister, Neil Gray. He's not interested. He just sits in his office all day, stimming like this, not answering the phone, the door locked, scared, gets out, mousily looks around, scurries out of his car, goes home, and cries into his pillow all night. I genuinely think he's so far out of his depth that it's affecting his mental health. It would be easy to ridicule, and I'm genuinely, as one man to another, I think he needs serious help. I think he's got a problem. I think the job's too much. It's got to him, and I think he's emotionally compromised. And I would say, genuinely, one human being to another, Neil Gray, go get some professional help. The de facto health secretary is, of course, John Swinney. And John Swinney doesn't know what he's doing either. He's got too many other things. He's spinning too many plates. And, nobody's looking after the NHS. So nothing is going to happen. Now, Public Health Scotland, who's like the overseeing body, has said that a total of 9,381 patients are waiting for care at home or social care assessment as of the 3rd of March. 6,508 people currently on a waiting list for assessments. And the figure has increased by more than 500 in a matter of a couple of months. And it's not getting any better. One of the problems is they don't have enough people even to do the assessments. And so, it's a bottleneck. And so you've got this bottleneck where people are trying to do the assessment. But at the top end, there's so many coming through, it's never going to catch up. And the trouble's getting back and back. It's backing up, there. The Tories are slagging off the NHS. Sorry, not slagging off the NHS at all, lying through their teeth. They're slagging off the SNP. The hospitals are saying it's a matter of cash. The SNP are saying it's a lack of management skills within the hospitals, and of course Westminster, and so forth. Everyone's pointing the finger at everyone else, but ultimately it's John Swinney. He's the head of the government, he's the head of the SNP, he's the de facto health minister. Pull your finger out, John, get your job done and sort this mess out. The only problem is you can't. You need money, and you've wanked all yours away on sending fat oafs first class around the world. Well, what do, eh? You could resign. That'd improve a lot of things, though, wouldn't it? Not just the NHS. Let me know what you think. Thanks very much. Goodbye.